Weight Management for Adults Part 1. Being overweight and obese in general is a public health problem. This program will help us develop and implement some good weight management strategies. So please subscribe and press the bell icon so that you can see all the audios and videos on this channel. Here I will discuss the health risks of being overweight or obese and the benefits of maintaining a healthy weight. This will depend on our readiness to lose weight and a willingness to modify behaviors to achieve and maintain an appropriate target weight. I will be discussing the role of diet, physical exercise, medicines, and surgery where needed in the management of weight. Obesity is a real problem, and there are many factors that cause excessive weight gain. Body mass index, or BMI, determines the degree of overweight or obesity. It's a measure that can roughly tell us if we are underweight, healthy weight, or overweight. BMI is a person's weight in kilograms divided by height in meters squared. BMI of 18.5 or less is underweight. Body mass index between 18.5 and 24.9 is considered healthy weight. 25 to 29.9 is overweight. 30 to 34.9 is obese. 35 to 39.9 is obesity level 2. And body mass index of 40 or above is obesity level 3. BMI uses your height and weight to work out if you are healthy weight, underweight, or overweight. There are certain variants. For example, older adults can have more body fat than younger adults. Women can have a healthy BMI but still have too much fat, as women tend to have more fat than men with the same BMI. A person of ethnic minority may have a body mass index that seems to be normal but can be prone to more risks of type 2 diabetes. An athletic person with a lot of muscle may have a high BMI but may not be overweight. If you are pregnant, use your pre-pregnancy weight to determine your BMI. The best way to lose weight if you are overweight is through a combination of diet and exercise. Waist size. To measure waist size, find the bottom of your ribs and the top of your hips. Wrap a tape measure around your waist midway between these 2 points. Waist circumference provides information about the distribution of body fat, particularly in the center of the body. Patients with an increased abdominal or central distribution of body fat have an increased cardiovascular risk and are more likely to have insulin resistance. Obesity is a major health problem due to its association with serious chronic diseases such as type 2 diabetes, hypertension, hyperlipidemia, cardiovascular disease, and deaths related to cardiovascular disease. Obesity is also associated with cancer, disability, reduced quality of life, and can lead to premature death. Around 5 to 6% of total NHS budget in the UK is spent on disease consequences of overweight and obesity. It costs the NHS over £5 billion a year, and by 2050, this is estimated to rise to around £10 billion per year. Obesity and overweight have a serious and widespread impact on society and national economy. Its impact negatively on employment opportunities and life chances in general. A study estimated around 16 million sick days per year in the UK directly due to obesity, with an average loss of earnings of £2.5 billion. So half of the total of 5 billion due to days off sick and can't go to work. The causes of obesity are complex and multifactorial. Biological or genetic factors contribute to 25 to 40%, and a major cause is excessive food intake. Although there is a downward trend since 2009 in the total food and drink intake, people still consume at least 5% more than their daily requirement. So the first step for those trying to lose weight would be to reduce 5% of the total daily intake of food. Some dietary risk factors include high energy dense foods, diets high in fats and low in fiber, a consumption of sugary drinks, and larger portion sizes. Physical activity is reduced due to fewer manual jobs, improvement in transport, increased car ownership, introduction of labor-saving technology, and a sitting lifestyle due to TV, computer, and screen in general. Health surveys of 2018 suggest that 27% of adults reported less than 30 minutes of mild or moderate physical activity per week and were classified as inactive. This is all for this video. Please subscribe and hit the bell icon for more. Thank you very much. Take care.